If you told a pregnant woman that her baby would be in a NICU, she'd be scared to death. And I can tell her now, of course it's a scary situation, but the place is not scary. The situation can be terrifying, but I think the people here made it less so.
Every day at Inova Alexandria Hospital, parents experience a comfortable birthing experience with caring doctors, nurses, and support staff who prepare them to begin their new life as parents of a healthy baby. But not every birth experience is that simple, and sometimes mothers and babies need special care. Here at Inova Alexandria Hospital, we have the heart of a community hospital and much more. We provide state-of-the-art care in our high-tech neonatal intensive care unit. Each year, we care for hundreds of premature or critically ill newborns, and we do it with the latest technology in a warm and loving environment. I'd like to welcome you to our hospital and hope you choose us for your special day.
Here at Inova Alexandria Hospital, our NICU is a Level 3 NICU. And a Level 3 intensive care nursery means that we can care for and provide excellent care to infants who are born at term, who happen to run into some difficulties at birth, to 23 weeks gestation. Those infants requiring the highest level of our expertise clinical care provided by our nurses and staff. Our state-of-the-art Giraffe Omnibids provide customized lighting and sound and temperature control for each infant that we have and assist them in their unique developmental needs. We focus here on developmental of care, creating the best environment for your baby to grow and to thrive. This includes reducing noise and light disturbances. So throughout the day, we bundle your baby's care and try not to disturb them too often during the day. We encourage you to be a part of your child's care. Initially, babies are not always able to be held, but we do help you with that. We show you your baby's cues. We show you how to touch your baby. We encourage you to talk to your baby. Then once they are stable, babies love to be held and can go skin to mom, and that's called kangaroo care. And we encourage that at the bedside. Babies love to hear their mom's voice, smell their skin, and feel their skin as well.
It may be a smaller hospital, but with that, there's a lot of luxuries that come with that.
Even the giraffes, I mean, you would think that every hospital has them, but in my research later, I found out, not everyone does. We were just lucky. We were just lucky that he arrived here.
You're not just a number when you're here. Everyone knew my name when I'd walk in. They knew exactly who my baby was. They brought little hats in for her.
It was like a family around here. I mean, it was comforting to be here. I mean, not just because my baby was here, but because I felt at home. I had my chair, I had my baby, and we just had, I think, the best possible experience we could have had for what happened to us.
I'm the medical director here at the Inova Alexandria NICU. The NICU is staffed by neonatologists who are board certified and who are here in-house 24 hours a day, 7 days a week, 365 days a year. Our medical staff are all members of Pediatrics Medical Group, the largest group of neonatologists across the country. But one of the most important members of our team are you, the parents. Here at Alexandria, we like to get you involved in the care of your infants from the very beginning. We believe highly in kangarooing your infants, in co-bedding multiple infants, and in providing an environment that ensures optimal developmental growth of your infant. Nobody wants to have their infant in a NICU, and most people don't know what NICU life is all about. But if you do find that you need a NICU, we look forward to being a part of your infant's very fragile beginning.
I was able to not only be included within the decision making, but I was also able to get periodic updates on everything that was happening.
They were great. All the doctors, anytime you had a question, they were able to answer our questions, and actually told us even before we had the opportunity to ask most of the time.
As one of the NICU nurses, I'm responsible for the day-to-day care of your baby. All of our nurses will be here to assist you in gaining confidence in providing care for your baby so that you will feel ready when it's time to go home. I will explain the clues that your baby gives, which will help you provide the most meaningful care, and will teach you all the tools you'll need to provide the special care that your little one may require, including training such as CPR if needed. Another important concern for many mothers is breastfeeding. We have new breast milk warmers and private pumping rooms here in the NICU and support from lactation consultants.
If you decide that you want to breastfeed your baby in the NICU, the nursing staff and the lactation consultants will work together to help you establish and maintain a milk supply. We also provide individual consultations and group sessions to support ongoing breastfeeding. If you need to purchase breastfeeding supplies, we have a one-stop retail shop for all your needs. We want you to have the best experience possible, and we are here for you.
I was pretty definitive that I wanted to breastfeed. So what they ended up allowing me to do was taking her into a breastfeeding room once she was able to go off the machines for a period of time and take her in there and breastfeed her. They have a wonderful facility where it's separate areas where you not only that, but they also have breast pumps as well. So you're able to pump if you're not going to be here for feeding.
I did a lot of pumping in the lactation room. A lot of premature babies obviously can't eat right away, so you do a lot of pumping, and it was nice to be able to do it so close. You know, you didn't have to go far from your little guy.
The pharmacist involved with the NICU by participating in daily patient care rounds and monitoring the drug therapy of each baby to ensure that the babies are responding appropriately to their medication.
You will meet respiratory therapists in the NICU. We are here to ensure that if your baby needs help with breathing, it is handled carefully and comfortably.
My role is to provide you with resources, support, and to work collaboratively with your insurance provider. If you are uninsured, I will connect you with the financial quality counselors who can assess your financial needs. As you will experience, a NICU stay is full of emotional ups and downs. I am always available for emotional support.
Maria was great. Our insurance wanted us to possibly go to a less intensive care unit because he was what they call a grower feeder. He wasn't, preemie anymore, and he needed to be held, and that was something that was not going to be available at an institution where it's more babies per nurse. Maria battled it out for us.
From specially trained physicians and nurses who care for you during your pregnancy to a full complement of birthing services, to include private rooms on our postpartum unit and our Level 3 intensive care nursery. There are so many reasons to choose Inova Alexandria Hospital as your hospital for your birthing experience, a community hospital within the heart of Northern Virginia.
I won't forget all the people that helped her. It was pretty amazing.
They took the best care of our baby that they could. They loved him. I can't say anything but that.
They saved my baby. What words can you put at that?